particular topic. Today we have with us Dr. Shalini Pradeep. She is a pretty senior academic counselor of CSC Development Program, and she's an expert in this particular field. So you'll be very happy to listen to him. And in the past also she has taken quite a few sessions. And today we expect that all of you should listen to her carefully and put your questions after the end of the session. So, madam, you can take over straight away because time is very short, so you can take over. Thank you very much.
Thank you. I have to share the screen with you all. I don't have that option of sharing the screen. Do I have that, sir?
Pardon, madam?
Can I share? I have a PowerPoint presentation. So I need to share that.
But it is not flashed.
Yeah, it's not.
You can go to the link present now.
Yeah. Is it visible now, sir?
No.
Yeah. Now?
No, it is not visible.
Yeah.
Yeah, it is showing. It is visible now.
Okay. It's not open fully, isn't it?
But that was okay, madam.
It was okay.
That was okay.
Now it's not visible?
Now it is not visible.
Is it visible now?
Yes. Yes.
Yes. Okay, so my topic for today is on how to plan a training program. Plan a training program for the waste handlers. So this is, as you all know, that training for the waste handlers is a challenge because of various reasons, because of their educational level, and they're not actually involved in the total process of waste management. It is only in the end they come. So how do we communicate to them before we actually plan on a training program? What are the things that we need to know? So this we have to communicate to them. So how do we communicate? What is communication? So it is a two-way process of sharing or exchanging of ideas, feelings, communication, information, emotions. So it is, why do we communicate? We want to communicate because we want to have a desired change in the human behavior. And we have certain goals. What is that goal that we have? What is the goal that we have? We have to teach them how to handle the waste in a safe way, in such a way that they do not get hurt in the process, or they are not vulnerable to any infectious diseases. Am I right? Yes. Okay, so it's a two-way process. It's not moving. It's not moving ahead, I think.
You can switch the next slide.
Yeah, but it's not moving.
Okay.
It's not going to the next slide, which is a problem. I think there's some problem here with my presentation. I am not able to present it. Can you see the slides now?
Yeah, slide is visible.
Okay, then I will continue. So the process of communication, how do we communicate to the waste handlers? Who's the sender? We are the senders. We have to have a message for training the waste handlers. So, and there is a channel of communication. What is that channel? There are various channels through which we can communicate. And then who is the receiver? Is the waste handler is the receiver. So how do we send it to them? So with this background, I, as a sender, as a trainer for the waste handler, what I must know is that my objective of what I should train the waste handlers should be very clearly defined. I should know what my audience is, their interest and needs, because we know that they don't need an elaborate teaching on the waste management. So, what is their interest? What they are supposed to do? What is that they need to know? That is more of an importance to us. And what is the message? What is the message that we need to convey to them? The message should be clear, and they should not be any um, ambiguity in whatever we are trying to communicate to them. There are various channels of communication, like we could have just a lecture, or we could, in the lecture, we teach them all this, or we can have a chalk and a board and we can write it. But there are certain advantages and disadvantages of various channels of communication, which I will tell you later on. What are the professional abilities and limitations of the sender or the receiver? The sender, my professional abilities may be more than what is required for a waste handler. So I should know what is that I need to teach them, and I should avoid every technical jargon. I should go to their level and speak in simple terms such that they are able to understand what I'm trying to teach them. Secondly, I would also like to tell it in their local language so that they're able to understand, because most of the waste handlers are the ones who are not educated. They may not have even done even their schooling also. So I need to be very careful in the way I teach them. They should be able to understand what I teach them. And I should encourage the interaction with the trainees. I tell a sentence, I make them repeat that so that I come to know whether they have understood what I meant. Or when I use long sentences, or when I say something, they may not be able to understand. they're just hearing, and at the end of the day they have not understood most of it. So it is better to stop at the end of every sentence, or at the end of every 2 to 3 sentences, ask their feedback, ask them to repeat what they have understood, so that we are on the same plane. The barriers to communication. I would, as a academician, we would like to tell more and more to the student, but that too much of information or too much of verbal communication may not be very useful to them. So we have to limit the number of words and the way we do the lecture. And if we do a lecture and they are not attentive, then there is no continuity. They will not be able to understand. Detailed or complicated information should be avoided as much as possible. Written information is better. Even in the written information, it is better to be in the local language, such that if they are able to read and write in the local language, they'll be able to understand better. And sometimes the messages are such that we think we have understood what we have written, but it could be misinterpreted. The message could be misinterpreted by the receiver. So as far as possible, try to translate in the local language and get someone to back translate, so that the message that you have given them should also be the same thing which they have understood. So remember that when you're sending a message across to them. So as we all know, most of the waste handlers are the ones who are almost adults. So they are, it is like an adult learning. So they need to be motivated. To be motivated, it should be directed towards them. And also, since they are having some experience in that particular field, their experience should be taken into account when we are trying to explain to them. It should be goal oriented, so that they know what they're supposed to do, what is not required from them. It should be relevant to their work practices. It should be more practical oriented, so that hands on training would be a best method for them to understand and to find out where they're doing mistakes, and this will help them in improving in their work skills. Reinforcement is very important. When we do something, we ask them to repeat it again. That is called as reinforcement. And when you go for the training and you see them, you also find out where they are, how they are working, whether they're doing the right practices. If they're doing the right practices, you appreciate them, so that there is a overall personal development in them, and it stimulates them to learn. They are more motivated to work well. And it is said that when you teach them in this way, they are able to retain it more. So, and because they retain more, the chances of them learning more and more and enjoying the work, retaining themselves in the job, is more practical. The transference of the skills is also required. When they learn the good practices and another new person joins the institute, the transfer of the skills is smooth, and this good practices is transferred to the next, and there is capacity building of this particular person. So there are various methods to teach them. It could be instructor centered, like I'm an instructor, I will teach them what they are supposed to learn. Content centered, that means we are only bothered about what is the content that they need to learn. That is more important for us. So that is, could be content centered. It could be learner centered. I am more interested in what he or she is supposed to learn. That is more learner centered. Participatory learning. I teach them, they learn from me, they also practice with me. That is participatory learning. So, this is participatory learning. You make them do it in front of you. It is almost similar to hands on training, where they pick up the right things And when we are watching them, they learn the right things. If you allow them to do on their own, if they have made a mistake, they continue to repeat those mistakes. So that is avoidable if there is participatory learning. Now there are various methods of teaching them. As I told you, first is a lecture. I give a lecture to them. Advantages, it is the most common method of teaching. We, like a PowerPoint presentation, I make them, they take down the notes, and there is face to face learning. One to one can be one to one interaction, or it can be face to face learning. But the disadvantages, it is monotonous, it could be boring also, especially when the speaker continuously the same tone continues to repeat. It could be monotonous and boring. There are no prompts. For example, if I'm teaching the student, in between I don't allow the student to speak anything. So there are no prompts in between. This becomes difficult for a new learning. Continuously teaching, the new learner will not be able to pick up the points. Another form is tutorials. The advantage is there is a better interaction, and also because of the individual attention, there is an advantage. I speak individually to that person, and if I want to show something, I can demonstrate, and I ask that person to repeat. If they are not able to do it in the right way, then I elaborate on how it has to be done. So this is the advantage, and it is an effective forum where we can teach number of people, and it also allows the student to explore. We can sit together and have a discussion, which is like a group. The advantage of this is when we sit together as a group, there are people who have certain doubts, so they can clarify the doubts. Certain topics which they have not understood, they can ask us again. Okay, so it develops confidence in them, and also in the both in the learner and in the teacher. So there is confidence building in this. As I already told you, demonstration is the most effective method because it's practical, it is more relevant. We demonstrate, we show. So seeing is believing. When I teach, it is only in the a certain method of learning that you have. Whereas when I demonstrate, you are seeing that, and you are seeing what are the right ways to do it. So it becomes more relevant and practical for the student. Work-based experiential learning is another method. It involves induction of the person to the training, then you assess them, and then after assessing them, you ask their reflections. How did they feel about the training? You do a briefing and debriefing, and you monitor how their work is going on. The advantages are it is at low cost, you have more workers that you can involve, and the recruitment criteria can be as a part of the student reflection. Also the recruitment can be done, and there is a pool of people with new ideas. So when we sit with, like, people from different hospitals are brought together, they are a pool of people. Some of them will give new ideas about how they have handled the situation. So that is the advantage of an experiential learning. And whatever theory, they have put it into practice. So they give you their viewpoints and their workplace culture. So you come to know what is their workplace culture, how is it different from your workplace culture, how you can incorporate the new ideas into your culture. And it also helps in developing a personal attribute.
Madam, is the slide not moving?
It is moving, you're not seeing it?
No, it is not moving.
It is not moving, huh?
Yeah, yeah.
You're not able to see the slides only?
Only the first slide, the second slide is projected.
Oh, so maybe after I finish everything.
It is moving now. Now it is moving. So the way you did, the same way you can do.
Okay.
Now slide number 12 is showing.
Yeah, visible now.
Now it is moving.
Okay, so the next one, can you see?
Yes, yes, yes.
Okay,
It is moving now. So you can now slide number 13 is showing.
okay. So there are various audiovisual aids also that are available, like chalk and chalk piece and blackboard. So this is the age-old method of which we how we used to teach the students. Even this is relevant even today because it is low cost, easily available, and it is real-time teaching. In the sense that at that particular point in time, the teacher is teaching the student and the student is able to see. But the disadvantage is if my handwriting is not legible, then you will not be able to understand. So in such a kind of instances, we usually tell, and the number of students should be less. It should be less than 15 to 20 students, because if it is at a distance, they will not be able to see. That is one more problem. And to make it legible, we can always use capital letters and bigger font size so that it is seen by all the students. And but there is no pre-planned material that we can give it in. So whatever I think about in the slide, in the during my presentation, I write it on the chalk, with the chalk and the blackboard. So the pre-planned material is not available with me. And since I'm facing the board, my voice will be directed towards the blackboard. And secondly, there'll be no eye contact. So the students may not be able to concentrate, or they may be busy in talking with each other during a group. So there can be discussions in the group, and this will not bring the entire class into focus. OHPs was previously used also. So we had OHP, which serves as a prompter, and here OHP is already written. So we just have to project it. Those papers, those slides, students can see that it is easy to prepare and it lasts long. For example, if I use the OHPs for today's class, the same topic, I can use those OHPs for a similar class of another duration of time. Okay. So, but the disadvantages, it is highly high recurring cost, and it is power dependent. If there's no power, I'm not able to continue with the class unless I'm well prepared without the OHP. All of you know what is OHP, the full form of OHP, no? Can the student, any of the student unmute themselves and tell what is the full form of OHP? Okay, it is
Overhead
called,
projector.
yes, yes, it is overhead projector. So it is visible easily. But here also you should remember that the slide, the OHP, the written format should be, the font size should be big enough so that the entire class is able to see. You also have slide with projector, which is similar to OHP, but here you have less material per slide. So you cannot squeeze in too much of material into the slides. Another one is flip chart. Do you know how a flip chart works? It is similar to what we have in a calendar, isn't it? We'll have one side which is facing towards the student, another side which is facing towards the teacher, right? Yes?
Yes, ma'am.
Okay, so the side which is facing the student will have the material in it. That is, it could be a photograph. Okay. On the other side, the side which the teacher has, it will have the written material so that they are able to read through what is there. So that is how a flip chart works. And posters, most of you have seen. Posters is usually one-sided with some diagram or some photograph and written material. So how a poster should be made also is very important, so that it is visually appealing to the eyes. Okay, so the poster should be prepared in such a way that is visually appealing to the eyes. Too much of matter should not be written in the poster because it defeats the very purpose for which it is intended to use. So when you're preparing a AV8, whichever form it is, keep it large and legible so that it is visible to everybody. And you should plan ahead in before the class. Thirdly, there should be eye to eye contact with the student so that they know that you are interested in teaching them, and they also should realize that the goal is being achieved. Okay, and there should be limited information on each slide. As I told you, the font size is very important. The distance between the words is also important, and you should do it in such a way that you don't block the student view. So you should stand on one side and then present your slides or the AV8s. You should give some sufficient time for the students to note down the important points. So being clear and giving time, pausing, interrupting in between, especially with the waste handlers, is very important because they need some time to grasp what is being told, and also because of their educational, they may not have an educational background. So it is important that we need to keep on asking them questions at the end of each sentence, trying to find out whether they are on the same plane as us, and also whether they are interested in listening to you. So, as I already told you, the background of the person whom you're going to train is very important. Are they fresh people who have just been recruited or going to retire? The people who are going to retire, what do you expect? What sort of feedback do you expect from them? Or what sort of interest or motivation do they have? They may not have as much as the person who is just entered into the field, isn't it? Whether they have an educational background, as I already told you, that with poor educational background, they may not understand. So you have to speak less and show more of pictures so that they understand. Okay, and they are also from the lower socioeconomic status, so their background is not very appropriate for you all to do this. So you need to work more hard to and to teach them this topic. Okay, and as I already told you, whether they are with or without motivation is also important for us, because without motivation, here in healthcare waste management, it is the motivation that is more important. The attitude towards the safe management, whether it is a doctor or a nurse or a healthcare waste handler, everyone need to understand it is their responsibility to manage the waste in the right way. Their experience, people with more experience are able to handle or understand earlier very faster than the people who are just entered into the job. Okay, as I already told you, language is a major barrier for these students because they cannot grasp the technical jargon that we use. So language is a barrier, and speaking in English to them may not be relevant for them. So we need to understand that before we start the training program. Okay, who are the people whom you need to train? Are the waste handlers in the labs, those who are involved in transportation of the waste, the cleaners collecting the waste from the wards, and those who are in the storerooms who are involved in maintenance. These are the people whom you need to train. So, what is the content of your training program? You have to introduce them a little to the, not very exhaustive, but what is it? Why you need to manage the waste safely? This is introduction to the rule. Just a simple one or two sentences why they need to do this. Then what are the various categories of waste and segregation of waste, why they need to do it. So it need not be elaborate. And you also have to tell them about disinfection, because it may not be that they have to do it, but they need to know that disinfection is also being done as a part of the process of safe management of healthcare waste. Sharps and the handling. This is important because during the, if the segregation of waste is not done in the right way, sharps, they may have a problem with the sharps and the handling. They may have needle stick injuries. They need to know a little about what are the where the final disposal options are happening, and what happens to the waste at the end. What is the life cycle of the waste? They need to know a lot about PPE. What is the personal protective equipments that they need to use? What are the personal protective equipments they need to use while handling or transporting the waste? Can you tell me? Yes, anyone? Can you tell me what are the PPE that they need to wear? You would have heard it in the previous classes. What is this? The personal protective equipment waste handlers need to wear.
Protection for safety.
Yeah. Can you repeat?
Protection and safety.
Personal,
Protection.
yeah, protection against all these injuries and the infectious waste. So that includes gloves, heavy duty
Glo-
gloves, then
Wear mask.
mask, then
Gown.
mm,
Head
gown,
cap.
then head cap,
Cap.
anything else?
Goggles.
Yes.
Shoe cover.
Are they asked to use shoe cover or gumboots, the heavy duty gumboots? Ideally, for waste handlers, they should use the heavy duty gumboots. Okay.
Okay.
And you need to practically train them, initially, so that when they are handling the waste, you should see that they wear all this PPE and transport or dispose the waste. Okay. And you can take them to various areas in the hospital and show them how the four categories of waste are segregated, so that they know which are the areas, critical areas, where they have to be careful. If possible, they can be asked to visit the common biomedical waste treatment facility. Okay, so this is the content. How is the methodology? How will you train them? You can have these various, it could be a combination of two or three, or it could be a single method. That is informal participatory learning. It could be demonstration, or it can be observation. Like they go to the areas of the hospital and observe how the waste is being segregated and how it is being collected. You could have discussion and workshops, site visit. You could have an activity also and make them do it. Or you could have a role play where you show how, what is the good practice and what is the wrong practices, and how those wrong practices can lead to certain problems in them, health issues in them. It could lead to needle stick injuries. So you can show them both the right and the wrong so that they understand it better. And wrong practices, why do we want to show it, is because we don't want them to do it and later on suffer. So they need to know what are the wrong practices and prevent those wrong practices. So teaching aids could be a flip chart or a manual. You could have OHPs, or you could have waste management practical classes, practical demonstration. For segregation, you could have playing cards for segregation. Like, what are the various segregation categories? We have only four categories, isn't it? How many categories do we have now?
Four categories.
Which are those four categories?
Um,
Yellow for,
For
yes, yellow for,
anatomical body parts,
uh, then,
cotton, bandage, beddings,
mm, anything which is soaked with blood or body fluids, isn't it? It goes into yellow. Then,
Body tissues.
yes,
then red bin
yes, red is for,
for plastic,
for
Rubber and
plastics.
plastic.
Yes, then next,
blue bin
Blue puncture proof container.
blue for
Blue
white,
for
puncture proof
sharp
container, ma'am.
sharp
Glass vials and broken
blue.
ampoules.
Blue is for glassware and broken ampoules, and white is
And
for what?
metallic body implants.
Yes, yes. So
And
you can have some playing cards for the segregation. Just no, the reason why they need to, why do they need to know all this? They're not going to handle all the waste, no? They're not going to do it, no? The reason they need to know is if there's a mix of the waste, when they're collecting the waste, they can identify that. For example, if the syringe and needle goes into the yellow by mistake, or maybe the sister did not know and she just, a student nurse came and she did that and she put it into yellow, what will he do? He'll be able to identify that there's a mistake, isn't it? So he'll be able to inform the sister that this is wrong and see that it goes into the right bin. Okay, so this is the reason why we need, he know needs to know also about
bec-
segregation. Okay, and background information is good, but this may or may not be required for them, but still they should know that there is a waste management plan and policy in the hospital. Okay, especially when the hospital is now with the NABH and NABL, they need to, sometimes the assessors will also ask these waste handlers whether they know all this, to find out whether they have been trained in all this. Okay, so they need to have some background information about the hospital rules and regulations that they are following, the protocols or the guidelines that are being followed by the hospital, isn't it? So, do they have a register or something, waste management registers? They will know about it. They should know about the waste management register, where the waste is being, who comes and collect the waste, and how frequently should the waste be collected within. It should be collected daily, but not beyond. Not beyond how many hours?
48 hours.
Hmm. Yeah. Okay, so they should know that. What are the treatment procedures followed in the hospital? Is disinfection carried out in the hospital? Chemical disinfection. Some of the hospitals. What about the sharps waste? Do we add a disinfectant to it? As per the rules, there is no need to disinfect the sharps waste, right?
yes, ma'am.
Yes. And what about liquid waste? Any waste from the labs? What do they do? Sodium hypochlorite, is it used?
Disinfection with sodium hypochlorite
Yeah.
solution.
Disinfection with sodium hypochlorite. So these are small things which they are not, it may not be important for them, but they need to know because as per the, as I told you, as per the NABH, all the
Yes.
healthcare workers are supposed to know what are the procedures followed. So on those basis, they need to know, though they don't do the disinfection or they don't segregate the waste, but still they need to know all these. Okay. So how will you evaluate after for the training program? Once you do a training, you can actually do a pre-test and a post-test. Do a test before actually doing the training program. You do the training program and then you same questions again. You repeat it after the training. So that is called as post-test, and you compare the pre-test and the post-test, and you see how much they have knowledge they have gained, how much practical also. If you're asking them to do something practical, you can also assess them practically also and mark them, and based on that you are able to identify whether they have understood your training. But it doesn't stop with 1 day of training or 1 hour of training. It is requires reinforcement every now and then, and also monitoring and evaluation to see that they are perfect on their job. And waste handlers as such are not many in number. Maximum you may have one or two, one for the day shift, one for the night shift, something like that. So as far as possible, you should see that they are retained in the hospital, and their health is also equally important, to see that they are healthy so that they serve the institution for a long time. Okay, I'll just show you one flip chart which we had developed in the department. Okay, are you able to see this?
No, ma'am.
Huh?
No, no, it is not,
No,
not.
not seen. Huh? It's on my desktop only. Now, is it seen now?
No.
No, no,
No,
it is not projected.
not seen. Huh?
No.
Here it's not seen it.
Madam, first open the slide and then present it.
Yeah, I've opened it on the desktop.
Okay. Okay.
It's not opening it out. Window. Can I just wait for a few minutes? I will ask help, you know.
All students are requested to please wait for some time because there is some issue on the slide. So till it is rectified, please wait.
I want to share this. Yeah, it's not happening. Which one? This one. Are you the host? No. But they have allowed me to share, you know, video sharing. That one. Platform is this one? This is Google Meet. So the desktop only. Stop it. Open my. Open my. Uh, so you will be able to see the content. Is it visible now?
Yes, yes,
Yes,
it is
ma'am.
okay now.
Thank you. So this is um, project which I had done on training component. It was done in 5 states in India. That was in Gujarat, Karnataka, Maharashtra, Odisha, and Punjab. Okay, so this is how we have done the manual for waste handlers. I'll just quickly run through this so that you'll know how we can do this. And this flip chart will be very useful if you have to teach these adults. Okay, so this, as I already told you, it is adult learning. That is, they are self-directed, and they bring in a lot of knowledge and experience to the learning activity, and they would like it to be more relevant and practical. So they are goal oriented because their goal is only to see that the waste is disposed, final disposal to the final disposal of area. That is the sub store. You'll have the sub store where you'll do it. Okay. And they are problem oriented, so they want to apply what they have learned. So since they are motivated, they are pressed for time, and they have different learning styles. So each person has different learning style, and based on the learning style, you will have to approach them. Okay. And see, the tip for your trainers, you as trainers, is to plan a training schedule in a way it is divided for 5 days in a week, allotting 2 hours per day. So it is based on the availability of the person. And as I already told you, it is the attitude which is more important. So regarding the clean practices to prevent the spread of infection. Okay. So this was done in 2016. We did it, okay, at the medical college, and we have also worked on the rules. So these are the types of lessons. See, like this you should make, where you have more of a diagrammatic representation of this. Okay, so this is what is visible to the learner. So you're going to tell what are the hazards of waste, that is air pollution, water pollution, HIV, AIDS, hepatitis B and C, wound infection, and sharps injury. This is the important thing that they have to understand. So only if you tell them stress on this, then they understand that their work requires them to have certain precautionary measures to be taken. Okay, so you start by asking what is it that you need to know, okay, to know their level of knowledge, then to give them a clear view of various types of hazards. Okay, so these are the things that you need to tell them, whether it is harmful or not, who is it is harmful, why is it harmful, okay, what are the hazards. So the types of biomedical waste you can tell them. Okay. So when they're picking up these waste, as I told you, if there's a mix of waste, they understand that they are not supposed to handle it immediately. They have to bring it to the notice of the staff nurse who's there or the supervisor who's there. Tell them this is the problem that has happened. Okay. So where are the various types of biomedical waste? Okay. And then how do you prevent infections by using all these personal protective equipments? Okay. And they need to also know that after handling the waste, they have to do a thorough hand wash. You'll have to teach them this, how to do their hand wash. And also, when they come to the job, they need to be protected against hepatitis B and tetanus. Okay, so they need to take these vaccines before they actually start working. Okay. So you'll have to stress on this robust infection control and practice of universal precautions. That is why they're using the PPE. This will isolate microorganisms, so it will be a barrier for the transmission of infections. And they also need to know that they have to take immunization against tetanus and hepatitis B, which I already told you. If at all they have an injury, they have to report immediately. Okay. Health checkup at the time of induction and once a year. This is mandatory as per the biomedical waste management rules. So this is the segregation of waste. Okay, this the different types of waste. So next they have to collect the waste, and this is how they have to collect. This is the right method of doing it. Biohazard symbol, the liner. So you'll have to talk about how frequently the waste is collected. That is at least twice a day or every shift. Okay. Once it is 3/4 full, it has to be tied and proper evacuation of the containers. Okay. And barcode to the liners. Okay. Next is the transportation. Using the service lift should not be used by other patients or anybody else. It should be totally free. They have to collect that waste and bring it to the storage room, that is within the healthcare facility. And use of closed trolleys is also very important. separate service lift and ramp for waste trolleys, hand washing, use of PPE, reporting of injury management. Then finally, it is the storage in the sub store. So you have 4 color coded areas where these wastes are stored. And that store should be closed with secure with lock and key, and it should be available only to authorized personnel. So these are the 4 things they have to always remember: wear heavy duty rubber gloves, mask, apron, boots, wash hands thoroughly after handling the waste. They should have been immunized against tetanus and hepatitis B. They should undergo health examination or medical examination once a year. Report any illness or injury, whether it is minor or major, to the management of the healthcare facility. It could be a infection control nurse. They should also remember there is no untreated human anatomical waste or animal anatomical waste or soil waste should be stored beyond 48 hours. So this the hand rub, hand washing, they should be taught the various steps in hand washing. Should tell them why they should hand wash. It helps to kill the germs which may cause disease. Hand washing to be done with soap and water when hands are soiled with blood or body fluids or after defecation. So steps in hand washing is very important. Use of personal protective equipments. Okay. And then how it has to be worn and how it has to be removed is also equally important, because during the procedure of removing it, they may contaminate their hands, or they may even use it to rub their eyes, okay, and spread the infection. So when removing the PPE, remove glove first. Hold the cuff of the glove with thumb and forefinger of the other hand, and then pull it inside out. Same way should be used for the other glove. Roll it, discard it, taking care not to contaminate the hands. Disposal of PP after that. Put the gloves into the red bin. Cap, mask, shoe covers to the yellow bin. So this is the immunization that they have to take, that is hepatitis B and TT. Now it is TD. So hazards from infectious waste and sharps. So the pathogens in the infectious waste may enter the human body by various routes, through puncture, abrasion. You'll have to discuss this with them, how it happens. So through the mucous membrane, by inhalation or ingestion. And why they should get vaccination is also equally important. These are the talking points to them. Infection with HIV and hepatitis B virus and C is of major concern. Okay. They are also vulnerable for tetanus infection while handling contaminated shafts. So they should get immunized with hepatitis B vaccination, that is at 0, 1 and 6 months, and TD vaccination. Periodic checkup once a year. Why? To detect early signs of any ill health or something. And it also includes medical history, focusing on changes in the health status, and exposure to infectious waste should be reported. Lab tests, if necessary, may be done. Okay. So the frequency and content of examination will vary depending on the type of work or the exposure that they have had. If they have any needle-stick injury, then immediate action has to be taken. What is that? So these are the ways in which they can get needle-stick injuries. Okay. So how to prevent is by adequate clothing should be worn during waste handling operations. Okay. All sharps should be discarded in puncture-proof containers. Check that the storage bags and containers are sealed, and the bags should be picked up by the neck only. That they should remember, always by the neck, and it should be tied properly. So sharps may occasionally puncture the side or bottom of a polythene container. It should be carried. That's why they should carry it by the handle. You should explain this to them. It should not be supported by the free hand, underneath with the free hand. Waste bag should not be dropped or thrown. Use cleaning equipment to clean the underside and other inaccessible areas of the cupboard. And not mixing the infectious waste with the general waste. If at all they have a needle stick injury, they should immediately wash with soap and water. Report the injury as soon as possible to the person concerned, and the details of this should be entered in the injury register. Post exposure prophylaxis should be initiated at within 72 hours, at least within 72 hours, depending on the evaluation of the risk that is there. So if any, they should not neglect if any injury happens while handling waste. They should report immediately. So proper management of shafts. It can happen that there is mixing of the waste, and such instances they may have sharp injuries, needle stick injuries. This spills can occur. Okay. Cytotoxic spills need not be told to them. Soiled linen, sometimes there may be soiled linen. Okay. This can be for the housekeeping staff also, use of disinfectants, housekeeping in healthcare facilities. These are the various things that you need to teach them. This is record keeping. You need to have a waste management register and an injury register. Okay. You have to talk to them about the why we need this record keeping in the healthcare waste, and this should be maintained for a minimum period of 5 years. So they need to keep a track of the count of bags, trolley trips, weighing the different color coded bags. Okay. So category wise waste quantification registry should be there. There should be an injury register describing the type, nature, and the treatment given. A logbook for tracking the waste movement from the point of generation to the storage. Okay. So these are the various registers that are kept in the sub store. So this can happen during the transport. So this is ultimately this is what is required. That is change in the attitude. So this is the take home messages for all of us, including the waste handlers. Waste may not be useful immediately to the user, but it is harmful if not properly managed. Infection control, robust infection control isolate microorganisms and thus constitute a barrier for the transmission of infections. Waste segregation at the point of generation. that is critical for appropriate waste management. Infected waste, yellow colored container, non-chlorinated. Recyclable waste goes to red. Sharps, white puncture-proof container. No waste should be stored beyond 24 hours, especially the organic waste. Hand washing, clean hands save lives. PPE, reduce the risk of injury, protects from exposure to blood, other potentially infectious materials and chemicals. Okay, so this is how immunization is an effective measure, preventive measure. They are exposed to many hazards, chemicals, biologicals, and radiation. So, periodic health examination is essential. Proper management of sharks will reduce the injuries. Okay. Spillages should be dealt properly. Soil linen to be handled as little as possible. Disinfectants are often hazardous, toxic, and they may be harmful to skin and mucous membrane. Good housekeeping means keeping everything in place after its use. Okay. So this is how we have done this flip chart. This flip chart was done especially only for the waste handlers. Otherwise, we have different manuals for various categories of healthcare staff. Okay. Thank you. Yes. So, any questions? Any problems that you'll face when you're training the waste handlers? What are problems that you can anticipate? Yes, Neelata? Any questions?
No, ma'am.
No. Snehata?
Yes, ma'am.
Any questions, Snehata?
No, ma'am.
Any problem that you are likely to face when you're training the waste handlers? No? Naresh? Okay. So we'll end the session here.
Yes, ma'am.
Sir,
Students, if you have any question, please put your questions in front of madam. Any issue pertaining to your CSCWM program and particularly the current topic, the present topic. Okay, madam, since there is no question, we can wind up.
yes, sir. Thank you, sir.
Thank you very much. Thank you very much, madam, for beautifully presenting, the topic that is planning a training program for waste handlers. And I think all our students must have understood fully. If possible, madam, if you could kindly share the, that PPTs,
Okay.
we will share with all the students so that they will be able to know many things
Okay.
from that. So it will be wonderful. So thank you very much once again. And I must thank all the students also, those who have patiently listened to the presentation. Thank you.
Thank you.